Good afternoon. This series is on face masks as a respiratory protection against the SARS-CoV-2 virus and from getting the COVID-19 illness. So there's three types of respirators. There are face masks, three types of respiratory protection. There's face masks, there's respirator masks, which are kind of a next step up in protection, and then there's elastomeric masks, which are tight-fitting, very much higher level of protection than the face masks and the respirator masks. So the face masks are typically the surgical type masks. They could be used by dentists, surgeons, or doctors doing procedures in clinics in the field. They are a loose-fitting barrier, physical barrier between the mouth and nose. And basically it offers a level of protection for both the user and the user's patient or the people around. They're regulated by 21 CFR 878.4040. The surgical masks are not to be shared. They can be contaminated, and typically they're a one use. They may come with or without a face shield, and they're often referred as face masks, but not all face masks are regulated as surgical masks. Surgical masks are a different thickness and with different ability to protect them from the contact with liquids. If worn properly, the surgical mask is meant to block large particle droplets, splashes, sprays, or splatter that may contain germs, viruses, and bacteria, keeping it from reaching the nose and the mouth. That's why the shield also is protection for the eyes, for bacteria and the viruses that from the splashes. Surgical masks may also help reduce exposure of the user's saliva and respiratory secretions to others. So it eliminates, it reduces that. It's typically not used to filter the air so much as just to stop the direct splatter into the mouth and the nose. Now it also, by design, it does not filter or block very small particles in the air that may be transmitted by coughs, sneezes, or some medical procedures. Surgical masks don't provide complete protection from germs and other contaminants because of the loose fit. They're not intended to be used but more than once. However, you can decontaminate these for use in the public where it's a bit not so much of the splashing and liquids sprayed at you. Now to put these on, basically you grab it by the straps here and put it into your fingers like this. The white side goes to the face, and if it's a colored side, that goes to the outside here. It goes under your chin and over your ears, and then you pull it under the chin and over the nose, and then you press it here. Should be a piece of metal here that will hold it. It'll minimize the opening between your nose and your cheekbone. It's not a very good contact here, and this piece of metal is very weak, and typically once or twice it's pretty much going to be providing very little protection as far as sealing the opening here. But basically there's air that can come in from the sides easily, from under the chin, but mostly along the nose here. A lot of people, and many people in the public, will use this type of a face mask, but they will wear it below their nose. This is not the way to wear it. It's not providing any protection for your inhalation. Now, because it could be contaminated on the outside, taking the face mask off is important that you do it in a proper manner so you don't contaminate your hands. But you put your fingers and your thumbs in underneath the strap, pull it out, and take it off this way. Okay? Now, you can fold it over on itself, or fold it inside on itself, and dispose of it. To dispose of it, you should put it inside of a plastic bag and then throw it into the garbage. This can be reused using something like these I got at a convention, but they have ethyl alcohol 70%. You can spray the outside and spray the inside. This particular mask, like I mentioned, when you put it on, the white to the inside. The reason being is the outside here is water resistant or liquid resistant, so it's designed to repel sprays and mists and humidity. The inside is designed to absorb. So the inside is going to absorb the humidity and the droplets coming out of your mouth and your nose. Keep in mind, this mask and all masks are less effective if you have a beard that separates it, provides an area that air can go in and underneath and around. So if you want the higher level of protection, you need to take off your beard, your facial hair, especially where it's going to be along the contact for the mask with your face. And that ends this series.